All right, Chapter 5, Medical Terminology. Some of the topics we'll be talking about is medical terminology. And like I said, this is going to be a very basic medical terminology, and it'll build throughout the chapters. The language of anatomy and physiology, and we'll be talking about anatomic terms. We'll start off with medical terminology. Um, just know that medical terms are a combination or compounds of up to two or more words. For example, smallpox. The word means small and pox combined. A word parts. There's a root of a word. For example, therm, meaning heat. And roots will be combined with a combining form like thermo plus meter equals thermometer. A prefix dis, and then knee, dyspnea, and tachypnea, meaning fast breathing and absence of breathing, or difficulty breathing, I'm sorry. And then there's suffixes like arthritis, itis being a suffix, meaning inflammation, and hemophiliac, which means lack of, so lack of hemophils. So you have to just learn these terms, and if you look in your book, there's a whole chart with all these terms on it. Word component examples like cardiologist, the root is cardio, which means heart. Lology, which means the study of, and is one who specializes. So one who specializes in the study of heart, or cardiologist. Acronyms, abbreviations made up of initials that can be pronounced as a word, like CPAP, continuous positive airway pressure. That's what it stands for. So take the first letter of each word and make an acronym, like CPAP. We have a lot of them in the EMS world. Dissecting a compound word, choleostitis. Choleo meaning bile, citis meaning sac, itis meaning inflammation. So a symbol, bile sac inflammation. So choleostitis is inflammation of the gallbladder. When and when not to use medical terms. We do not want to use it when we're speaking to patients or family. That's one way to kind of make yourself look like you're talking down on someone by using these big terms to this patient or the family when they don't understand what you're talking about. Occasionally, complex terms used in messages can cause confusion, even among trained healthcare professionals. And sometimes it's just a matter of mispronouncing one little syllable or whatever in that word, and you've completely changed what disease process or symptom or whatever you're trying to describe. If there is a potential for ambiguity, sorry, cannot pronounce that word. It's better just to use simple terms. So if there's any chance that can be confused, just use smaller terms or simple terms. Anatomy and physiology. Anatomy means the study of a body structure, and physiology means the study of the body's function. So, for example, a bicep muscle would be anatomy, and how the muscle contracts and moves and what it does would be physiology. Anatomic terms. So we talk about the anatomic position. When we describe the anatomic position, that's your patient facing forward, standing up, arms to the side, palms forward. And I'm sure in your book, if you have this book or the ebook, they'll have a nice big picture of this. The body is divided into planes. We'll talk about those planes a little later. There's a midline. The midline is, and when we talk about midline, we're describing medial is closer to that midline. So if something is medial, it's closer to the center of the body. And lateral means it's farther away or farther to the side of the body. For example, we could talk about your appendix could be medial to your belly button or your umbilicus. Bilateral means both sides. So if something's described as bilateral femur fractures, that means they have both of their femurs will be broken. Unilateral means one side. We see this described a lot in like a stroke-like symptoms, or it's unilateral weakness. Or there's mid-axillary line. That's the line that splits you front and back. That's what the mid-axillary line does. It splits you from front and back. When we're talking about the front, it's described as the anterior or ventral So if you hear somebody talk about the anterior or something's anterior towards the front. Posterior means back or dorsal. That's your back. Like your dorsal fin on a fish is on top of his backbone. So that's pretty easy to remember. Superior is ventricle or above. When someone acts superior or you're superior, that means they're above you. Inferior means below. So an inferior species or something would be below. When we're describing an injury, it could be superior to something or above it, or inferior below it. Proximal means closer to the torso, and distal means farther from the torso. You'll hear that described sometimes when we're describing injuries, like he has a laceration proximal to his knee, or distal from his knee, or hip, or whatever. Palmar refers to the palm of the hand, and plantar refers to the sole of the feet. Here's a nice picture showing directional terms and different body regions and anatomic position. So this is the anatomic position, facing forward, arms to the side, palms facing forward. They're talking about some planes. The one on the right is that mid-axillary line, and then the other one is the midline. So the midline divides the body right and left. The mid-axillary divides it front and back. Mid-clavicle line divides the chest into regions. It's right in the center of the clavicle bone. Since there are two clavicles, there are two mid-clavicle lines. You got a right and left mid-clavicle line. Here's some of the different body planes that you should know. We don't really use the planes too much to describe, but it's nice to know where they are. So if you want to take a minute to look these over, you can always pause the video at any point and look at any of these things that we're talking about, or you can always rewind and go back. Directional terms, abdominal quadrants. We have four, right? Quadrant means four. Horizontal and ventral lines through the navel. So the navel is your center point for your quadrants. So you got right upper, right lower, and left lower quadrant. We use these to describe pain, abdominal pain, like patients complaining of a 9 out of 10 left upper quadrant pain. Here's a nice picture that you should pause maybe and kind of learn a little bit which organs are in which region or quadrant. As you can see there, some organs lie in more than one quadrant. So, like your liver, for example, is in both upper quadrants. Same way with your stomach. Even though it's mainly in the left upper, it still wraps around and goes in the right upper a little bit. Some important things to remember is your right lower quadrant will be your appendix. That could cause some issues. And your kidneys. Remember, your kidneys are not actually in a quadrant. They're in the retroperitoneum, which is behind the peritoneum. The peritoneum is this like lining that holds all your organs in, and they're outside of that lining in the retroperitoneum. Positional terms, supine. That's when someone's laying on their back. They're supine. Prone is when someone's laying on their belly or abdomen. And we're going to talk about the recovery position. I've mentioned it before, but it's patient laying on their side, preferred for any unconscious or non-trauma patient. A lot of times we do the left recovery position because, like I said, when we put it on the cot and they're in the left recovery position, they are facing the EMT or the paramedic in the back of the ambulance. Here's a good picture of supine and prone. And here's the left recovery position. Fowler's position is a patient seated straight up. This will be important with people that are having trouble breathing. They'll want to sit straight up, so they'll sit in a Fowler's position. The semi-Fowler is leaning back in a semi-sitting position or at a 45-degree angle. And this is the position that we transport most non-trauma patients that have C-spine involvement. So if you have a C-spine involvement, they're going to be transported supine on a backboard. Whereas if it's non-C-spine involvement, if we don't worry about a head, neck, or back injury, we'll put them in a semi-Fowler's position usually. And there's a good picture of a semi-Fowler's position. And you see him secured with all the straps as well. Really short chapter, so let's do a real quick review. Medicine has a language of its own. As an EMT, you will frequently communicate with medical professionals who speak this language. And I will tell you right now, we do see it quite often, but a lot of times we see simple terms as well. So it's okay if you want to talk in simple terms, even to the medical professionals when we're handed off to nurses. It's okay to say our patient has high blood pressure, or it's okay to say they have hypertension. Um, but if you're going to use the medical term, make sure that you pronounce it right and know what it is. And when we're documenting, which we'll have a documentation class coming up, um, you'll want to document using simple terms. Maybe patient states has a history of high blood pressure, she's a diabetic, whatever, and so on. Medical terms generally consist of a root with a prefix or suffix. Remember, it's a combining of words. Medical terminology is a language of healthcare. Roots, prefixes, suffixes can lead to clues to the meaning of the terms. Like, for example, anything with the suffix of itis, I can tell is inflammation or swelling of some sort, like an appendicitis, that's an inflamed appendix. Understanding anatomy and physiology is like reviewing the owner's manual of the body. Anatomical terms brings precise and accuracy to your description. So if you start talking about wounds being distal, being proximal, they were superior, inferior, they were on the interior side, the dorsal side, posterior side, it makes it more accurate. Instead of saying, hey, they had a cut on their leg, we can say it was anterior, proximal to the knee, and so on and so forth. All right, that was that chapter. You're more than welcome to go back through them and answer those questions and review a little more if you like. And as of like always, if you have any questions of any sorts at all, you can always leave a comment down below and I will get back to you as soon as I can. So we'll see you next time.